I'm actually really excited about sharing this technique with you. It is probably one of my absolute favorite foam rolling techniques, as well as self-care techniques. And I'm going to bet that many of us are needing it right now. Some of us are probably coming in with some back discomfort. And then I did a lot of sitting yesterday, doing a lot of computer work and phone work for the clinic. And so that definitely has contributed to some more compression in my back. And the technique I'm going to give you today is really wonderful for back pain. It can also be really great for individuals that have a lot of lower abdominal restrictions, maybe from C-section scars, endometriosis, digestive discomforts. This is a great technique also for our runners or individuals that are possibly sitting a lot at the computer or at work. This is going to be a great technique for that. So if you have a foam roller, you want to grab it. Some individuals will want to grab a pillow or some form of support. I will show you how you can use that if you choose to. So you can either use your short foam roller with this, or you can choose to use your longer foam roller. I do prefer with this to utilize my longer foam roller, so that's what I'll be using today, but either of them will work for you. And again, you can have that pillow next to you if you do need it. So like I said, the first technique that we're going to do is more for the lower abdomen. So positioning is going to be important for this one. We are going to want to make sure that we are above that pubic bone, which is in the lower part of that pelvis. And then the bones on the front part of our pelvis, we're going to want to make sure we're below that. So we're kind of right in that sweet spot. So you want to grab your foam roller as well as your pillow if you need it. And I like to find where my pubic bone is, and then I'm going to come onto the foam roller and just rest just above that pubic bone. But again, we're going to be below those front of the pelvic bones. So it shouldn't feel like you're digging into the bone. You should feel like you are kind of right above that pubic bone and into the soft tissue. Now for many of you, especially if you have C-section scars or a lot of lower abdominal adhesions or restrictions, this can be very sensitive for you. So we're going to want to make sure to go very slow. This is where that pillow comes in. If it is very sensitive for you, you can choose to try the pillow vertically so that you can rest down on it, or you can also try it horizontally and rest down on it. So I typically tend not to use the pillow, but by all means that is a modification that you can do. Okay, so our first step anytime that we get onto this foam roller is most of us, because it is tender, are going to be bracing a bit. And so we want to make sure that we are starting to just kind of soften into it. Majority of our weight should be right at that pelvis. You don't want to have a lot of weight resting into the arms if at all possible. I like to start upright so that I can work on softening. So what we're going to do is bring our awareness to our calves and the backs of our legs. And we're just going to start to imagine that those areas are starting to just kind of, with each exhale, melt, soften towards the floor, just kind of softening down. And then the next place that we're going to start to bring our awareness is through our tailbone, our sacrum, and we're going to start to imagine that area starting to sink, melt, and just drop towards the floor. At this point, if you feel like your upper body wants to start lowering down, you can allow it to. And then what I like to do as my pelvis is starting to soften and gently applying some pressure down into that foam roller, I like to bring my awareness to my low back spine. And I like to really imagine that my spine is just sinking and melting towards my abdomen. My whole body is just becoming nice and heavy into the floor. Now again, if you're feeling too much pressure in at that foam roller in that front of the pelvis, you can use that pillow. You're going to see me moving around. Try not to move around because I'm going to show you modifications. But you can bring that pillow out, support yourself a little bit more. That's going to take some of that pressure off of that pelvis if this is very tender. At this point, you should start to be feeling the intensity lessening. Should be softening a little bit. If it's not, bring that pillow out and modify. If you are starting to feel that softening, I want you to continue to allow yourself to just kind of melt onto that foam roller. We should be feeling just some nice gentle elongation of that low back spine. This is great to create length through there. I also like to really bring my attention and my awareness to my sit bones and imagine that my pelvis, it's almost as if it's rolling and dropping away from my spine, creating some length through that sacrum and spine region. And your goal is just to continue to just soften. If you're getting areas that are pretty tender or sore, I encourage that you just draw your breath into that area, acknowledging that tension. And a lot of times it'll automatically feel as if it's just softening down. Find a comfortable place for your head to rest. Again, as you start to release more and more, if you're using that pillow, you can start to let that pillow go. And we would ideally start to hang out onto this foam roller in this position for a minimum of 2 minutes. There are a lot of times that I'm hanging out here for 5-10 minutes just because it feels so elongating, so nice through my low back. And many times as you continue to soften, you may automatically feel like your pelvis just wants to, it's almost like it unwinds, it unravels a little bit, or your spine. Go ahead and allow that to happen. That's that back freeing up, opening up. It's a really great technique for the back.